All right, it looks like we are live. Good morning, everyone. Welcome to the first live stream the Washington Poison Center has done in a long time. So for folks who used to watch our live streams, we're back to doing them again. So my name is Alex Sorotsky. I am one of the educators of the Washington Poison Center. I am super duper excited to introduce Dr. Sasha Kaiser today. She's going to be walking us through quite a bit of information on naloxone and a bit on opioids. Before we dive into that, though, let me do a little bit of housekeeping and remind folks that it is National Poison Prevention Week. So this is a time for poison centers and poison center partners and really everyone to kind of think through and acknowledge how we all can help prevent poisonings from happening and what we can do when poisonings do happen. National Poison Prevention Week, like I said, it's going on right now. It is going through the rest of this week until March 23rd. So keep an eye out on our Facebook, on our social media. You'll see some other events coming up for the Poison Center. So later this afternoon, if you have additional questions on opioids, fentanyl, naloxone, anything like that, please feel free to join our webinar. Like I said, today at noon, we'll post the Zoom link to that in our comments section. And as we are going through the next 15 or 20 minutes this morning, as Dr. Kaiser walks us through what we need to know with naloxone and opioid overdoses, please, if you have questions, ask them. Go ahead and post them in the comments section. We'll do our best to answer those live, but if we don't have time, we will always, we'll make sure to go back and respond to those comments and questions directly. All right, now going with the intro out of the way, let's dive into our questions, Dr. Kaiser. So very first one, just to kind of ground us here this morning, what is an opioid overdose?
Yeah, so an opioid overdose is basically when you have too many opioids on your receptors, and you have kind of a difference between an intoxication where you have this kind of sense of euphoria and calmness and pain relief. And then the overdose is when there are more receptors stimulated. It's kind of the poisoning aspect of that. It's the end of the spectrum. And so what you'll see with this is you'll see somebody who's not responding, who's not waking up, even when you're shouting or yelling or kind of shaking them. Either they will have very slow breathing or they won't be breathing at all. Oftentimes they'll have kind of a grayish tone to them, or a grayish tone to their face, to their skin, to their lips. Their skin may be cold or clammy. They may have really small pupils as well too. And then sometimes their breathing can kind of sound like they're snoring or gurgling. So those are all things that you will see when somebody has had too much opioids, and it kind of brings it to that other end.
All right, so if you're out in the world or even just at home and you see someone exhibiting any or all of these symptoms, what should you do if you think someone might be overdosing from an opioid?
Yeah, so the first thing that you want to do is you want to try and wake them up. And you can start with kind of a general tap, a yelling. If they're not waking up with that, you can kind of rub your knuckles on the front of your chest, because really you want to see if they're responding to you. And then when they're not responding, you want to make sure that you call 911, because you're concerned for an overdose, but there also may be other medical problems that are going on. And so you want to have the help that you really need for them. This is the point where you can make a difference with what happens if you think it's an overdose by having something like naloxone on your person as well too. And so if you have that available, this is something that can be life-saving. If they're not breathing very well, if they're not responding to you, you can look at administering naloxone. And this right here is what your naloxone will take a look at for your intranasal portion to it. And there's a couple of different steps that you want to do. So first, we're trying to wake them up. If we recognize that they're not waking up, we've called 911 so that we can get help. And then we're going to put them on their back, and you're going to go ahead and take your naloxone packet. Oftentimes you have to peel it out, and you'll hold it like this between your thumb right here on the plunger part and your fingers on either side. And you're going to go ahead and insert it all the way into their nose. And then when it's all the way in, you're going to go ahead and press firmly. One of the things to know about this is there's only one dose per package. So you don't want to test it ahead of time. You don't want to try and do it beforehand, because that, if you've done that, then your dose is gone. And so you really want to make sure that you use it when you do this. And it's very similar to something that you do with like a sinus spray. It's a really easy thing to do. Then the next thing that you're going to want to do is you're going to want to stay with them. And during this time period, it takes a while for naloxone to work. It takes a couple minutes. And so there's a couple different things that you can do. When you're on 911, oftentimes they will kind of direct you about doing things like rescue breathing or doing hands-only CPR. And if you are comfortable with doing that, we really recommend that you look at doing that, because we want to make sure that oxygen is going to their brain and to their heart while we're waiting for this life-saving medication to work. If you do not feel comfortable with doing that, one of the things that we recommend you do is to kind of roll them onto their side into this recovery position. And the reason why we recommend that is because if they do vomit, we don't want them to vomit into their lungs, which would make it even harder for them to breathe. So we're turning them so that their face is moving this way, and to make it easier for them to breathe. If there is a trauma, if there's other things that are going on, obviously we're counting on your 911 dispatch to help you with that process. But if we really think that this is an overdose, either the rescue breathing or turning them on their side is the best thing. And then you want to stay with them while you're waiting for EMS to come. If they have not woken up in the next 2 to 3 minutes, then we're going to look at giving a second dose of naloxone. Again, it takes time for it to work, so we want to give it that time to adequately go from in the tissues in your nose to your bloodstream to your brain to cause you to breathe. And if in 2 to 3 minutes they haven't responded, most of your packages come with 2 different doses. So we'd look at giving another dose at that point as well too, and then going through that same process. If you feel comfortable rescue breathing, something that we really, really recommend to help them through that time. And then the reason why we want 911 to get there is because even if they do wake up, the problem is that the opioid that they had on board, whatever they were exposed to, fentanyl, oxycodone, methadone, it can last longer than naloxone. And so we want to make sure that EMS is there to help them. So if they need other doses, or if there's something else that's going on, they can help provide care for it. And the great thing about naloxone is that it's a safe medicine to give. This is not something that if they have something else on board, it's not going to reverse those. It's only for opioids. If there's somebody who is having a stroke or a heart attack, it's not going to hurt them to give this. This is something that is safe to give, and we really do recommend it if there's any doubt whatsoever. It's safe for children. It's safe for who've had accidental exposures. It's safe for people who are pregnant or people who are breastfeeding. This is something that can be life-saving because it can make sure that you get the oxygen that you need to your body.
Well, thank you so much for walking us through all of that. That's such helpful information. And I think that's, for me, when I very first learned about naloxone, one of the most important things I learned from that was what you just said, that it's not going to cause harm if you give it in a situation where there's not actually an opioid causing an overdose. It's not going to help in that situation, but it's not going to cause that harm. And that really reinforces the importance of making that initial call to 911 in case there is something else going on that they can help you with. Now, I am noticing a couple questions that have popped up on our end, so I'll read this one we see on Facebook here. Do you need to occlude the nostril that is not getting the applicator in it for administration?
You don't have to. I think this is something that is muscle memory for what I'm doing right here. It's something that's easy to do. Really what you're looking at doing while you're doing this process, and it's not you doing it to yourself, is kind of supporting their head through the process with it. And so more the goal is to get it all the way into the nose to make sure that the medicine is going where it needs to go. So that was just me being used to putting in sinus nasal medication.
For sure. And can you quickly explain, what does that word occlude even mean for folks who have never heard of that term?
Yeah, occlude means to close off, to make it so there's only one available.
All right, awesome. Thank you. All right, now I am seeing another question that looks like this is popping up on our YouTube. How do I distinguish between agonal breathing and an opioid overdose?
So the hard part about that is you can have agonal breathing with an opioid overdose. And oftentimes opioid overdose, what this really means is that you were just not breathing enough. And there's lots of different ways that this can look like. This can look like somebody who is only breathing, 4 times a minute, which is not enough breathing. We want you to be breathing about 1 breath every 5 seconds. This can look at somebody who is breathing with kind of this gurgling respirations as well too. And the hard part is gurgling respirations can mean a lot of things. When somebody's kind of got this snoring kind of sound to it, this can be medical problems like strokes. This can be problems like having a bad pneumonia. This can be your blood sugar's too low. This can be after a seizure. But it also can be in the setting of an overdose. And if we have any concerns whatsoever, this is a really, really safe medicine. So I would try that while we are getting 911 to the patient or to the person to make sure that there's not something else going on that they also need to address.
All right. So to sum that up, a lot of things can cause trouble breathing or labored breathing or even a lack of breathing. Opioid overdose is certainly one of those. And so to help rule that out or to help address that in case it is happening, we got to give that naloxone. All right. So I'm seeing another question here. I want to carry naloxone with me at all times, but frequently just carry a wallet and keys when in town. Very small town, and we're a four-season area. Is it very harmful to leave naloxone in the car at all times?
So manufacturers really recommend that you keep it out of light and that you keep it out of the extremes of temperatures. What I will say is that there have been studies where they've looked at naloxone that's been kept in first responder, like police cars, ambulances for 30 plus years to look to see, does it still retain its efficacy? And the good news is that it still has really good concentrations of naloxone despite being in those extremes of temperatures and extremes of light as well too. In order to really optimize, we really do recommend you try to keep it in a controlled area. And so one of the things that you can actually get are little keychain things that can actually hold your naloxone and won't trigger it. And those can be really, really helpful when you have a lot of things going on and you just want to keep it on your key ring, keep it in your purse, keep it in your backpack. But if something happens and the only place that you have it is in your car, I would still use it. I would not move away from not using it because you're worried that it got too hot that day. Whatever you have available, you are protected under the Good Samaritan law to go ahead and give this as long as you are doing this in good faith that you're trying to help that person. And if you can keep it in a little bit more controlled environment, great. But if that's what you have available for you, I would use what you have.
Excellent. Thank you. All right. Now, folks, keep asking questions as you have them, but I'm going to move us on to some common misconceptions we come across, and we'll see what Sasha or Dr. Kaiser, excuse me, has to say about them. So we hear a lot when we're out giving naloxone trainings, concern about aggression when someone comes back to consciousness. Medically speaking, what's going on there? Can you tell us a little bit about that, if that's something we should be concerned about?
Yeah, and so when you have somebody who has been using opioids for a while, your body gets used to this and you have some dependence with this medication. And then when all of a sudden you take that off of those receptors so that the person can breathe a little bit better, not only do you help them breathe, but you take away some of the other side effects of the medication, like the euphoria or the pain relief. And that can be a little uncomfortable. And so sometimes people, when they do wake up, they are a little bit agitated. What I would say is it's better to have a breathing, agitated person who is alive than somebody who is not breathing and either dies because they don't have enough oxygen or has a really bad brain injury from not getting enough oxygen. And the great thing is again, by calling EMS, by calling 911 in these situations, if that does happen and they start to get uncomfortable with this, there are medications that the ambulance providers that can give, or there are medications that we can give the patient once they get into the hospital as well to make them more comfortable. And so, you know, this is the goal of this is to have somebody who's breathing at the end of this experience. And so it may be a little bit uncomfortable right after they get to the naloxone, but we can help with that. And we want to help with that. But we would rather have you be alive and able to tell me you're uncomfortable.
Absolutely. All right. So like you said earlier, Dr. Kaiser, when you open this package, typically there are 2 doses in there. So is there any reason why I shouldn't just put both doses of both nostrils and administer both at the same time?
Yeah, so the doses are actually were figured out to see how much medication you need to push the opioid off the receptor. And so they work really, really well. But sometimes, again, what it means is it takes a little bit of time. And so if you can get away with just having one dose and they wake up, then great, you have another dose for another time. If it doesn't seem like they're waking up, you can give another dose a little bit later. But sometimes if you give those 2 doses right away, it can push even more of the opioids off the receptors in your brain and can make it even more uncomfortable. And so this is kind of the safest way to do it and the most comfortable for the patient as well, because our goal is for them to breathe. And so this gives us opportunities to give it time to work, and then give another dose if we need to. And if they don't need it, then they don't need it. But it's kind of the best option for the patient.
All right, thank you. Now, we've very intentionally been using the term opioid or opioids quite a bit during this live stream. So just to clarify, in case anyone is uncertain about this, does naloxone work for all opioids, or is it just fentanyl that it works for?
Yeah, so naloxone was actually developed over 40 years ago. And so we've been using it on a lot more than just fentanyl. Fentanyl is one of the newer recreational drugs that we've seen, especially in the Pacific Northwest in the last 6-7 years. But before this would be a medication that we would use when people would come in with heroin overdoses, with too much oxycodone, too much methadone. There are lots of opioids out there, and this works really, really well because they're all going for the same receptors. And so it works on a lot of other things besides fentanyl. And if you see somebody who, again, has this kind of picture where they're just not waking up, they're not breathing very well, they look kind of gray, this is a great time to look at using that medicine, because that sounds like an opioid overdose.
Absolutely. All right. Now, you spoke a little bit to the Good Samaritan law, so that protects us from when we're trying to help someone who's in an active overdose situation. Now, would I get in trouble just for carrying naloxone on me, even if I'm not actively responding to an overdose?
Yeah, that's a great question. So the Good Samaritan law predated a lot of evaluating patients who are overdose. And really it was like to protect you if you were going in to help somebody and you thought that they had a medical need. As we started to see more overdoses, one of the things that they wanted to do is they wanted to provide protection in that situation as well. And so if somebody is overdosing and you are looking at giving them help, if you call 911, they are not going to get in trouble for overdosing. You're going to not get in trouble even if you're using drugs at that same time either. And 2, what this means is that you are safe to carry naloxone. It is not drug paraphernalia, and you are not going to have any arrest or concerns about having naloxone. And also 2, it's safe to call 911, and that person who's getting help is not going to get in trouble for that either.
All right, thank you. Okay, let's move on a little bit. We're running a little short on time. That's often how these live streams go. We always have so much to say. So let's talk a little bit about where folks can get naloxone. I heard recently that it might be available over the counter.
Yeah, so there's a lot of different ways that you can get this. You can buy it over the counter, places like Target, Walmart, I think Amazon have it. It's about $45, which in the grand scheme of things, $45 to save a life is not a lot. But there are other ways that you can get it as well too. You can go to stopoverdose.org. There is a couple other websites that I think we can probably throw in the chat as well too, that look at other places that you can look at accessing it in Washington State. You can also just go to any of your local pharmacies as well, and you can get it without a prescription. And so even if you're going someplace else that maybe doesn't have the over-the-counter product, you can still get it in their areas as well.
Excellent. And I think it's because, correct me if I'm wrong, but it's my understanding that because we have that standing order in the state of Washington, oftentimes, not always, but oftentimes insurance will cover at least a portion of naloxone due to that standing order.
Yes.
Excellent. All right, so let's jump to some of the questions while we have a minute or 2 left. Let's see. I am seeing, is it safe to use naloxone to get off of opiates or opioids?
So naloxone is a great drug, but it's a very short-acting medication. And what it's going to do is it's going to reverse some of the side effects of the opioid. If you are looking at getting help, There are other medications that can be prescribed that can either help with your symptoms or help to take the place of the opioid in a safer way. And so these are things in the community like buprenorphine, like methadone. There's other things as well too. And so I would say if somebody is overdosing, if they have too much on board so that they're not breathing, we want you to use naloxone. But if you're looking at getting help afterwards, there's lots of other places that can provide medications or other ways to kind of help you with your symptoms, depending on what your medical needs are, depending on what help you need.
Excellent, thank you. That's helpful to kind of break down the short term and the long term there. And really just a reminder, there is excellent support for both out there. All right, I'm seeing another question here. Is there anything to watch for or be aware of when observing someone after an overdose, especially if they check themselves out of the hospital against medical advice?
So a lot of hospitals, when somebody comes in with an opioid overdose, will try to make sure that you have naloxone on you after you leave. And the thing about naloxone is if you are overdosing, you're not going to be awake enough to give that to yourself. And so having somebody keep an eye on how you're doing from a breathing standpoint, if you are waking up enough, it can be really, really helpful. And there's a lot of videos online that can show you how to use naloxone as well too, that go through the steps. It's a pretty quick process. But a lot of times breathing is the biggest part of it. Most hospitals will watch you for a little bit of time to make sure that the effects are not reversed, that it doesn't wear off, and that you still have opioid on board. If you decide to leave against medical advice, we really do recommend that you have somebody with you who's able to kind of be in that same spot and then also has naloxone and also has a way that they can call to get help if they need to.
All right, excellent, thank you. Well, folks, we are about at time. So if we didn't address your question live, we will, I promise you, we'll go through and reply to every comment on there. Before we sign off, though, Dr. Kaiser, are there any final thoughts you have that you'd like to share to everyone watching?
Yeah, so with Poison Prevention Week, I think one of the things that we really want to make sure that everybody knows is their resources. And so the Poison Center is a free resource. We're open 24/7, 365. This is a confidential conversation. And so you call this number 1-800-222 1222. And if you're here in Washington State, if you're here in another state, it's the same number each time. And so we're here to answer your questions. If you're worried that your kid got into something that they shouldn't have, if somebody accidentally took a double dose of medication, if you're worried about what to do because somebody signed out against medical advice after they had an overdose on an opioid, we're happy to kind of talk you through what to do next and to really make sure that you have the tools that you need. So we're here.
Absolutely. Thank you very much, Dr. Kaiser. Last clarifier I'll throw in. We're sharing our number here, and there are so many opportunities and occasions where we really recommend you do call the Washington Poison Center. But to reemphasize what Dr. Kaiser explained, if you think someone is having an opioid overdose, especially if they're not breathing, they're not responding, please contact 911. That's a time where we're going to say, please bypass us and contact 911.
Absolutely.
All right. Well, Dr. Kaiser, always a pleasure. Thank you so much for joining today. And folks, whether you're watching live, whether you're watching the recording, keep throwing those questions on the comments, and we'll get to those as soon as we can. Thanks, everyone. Stay safe and have a great rest of your day. Bye.
Thank you.